response. Well, to speak to us about what could be the way forward, looking at the daily pattern of infections in this country, we're joined by Wits University's public health professor Laetitia Rispel. Also joining the conversation, Right to Care founder and ministerial advisory committee member, Professor Sanne. Good evening to both of you, and thank you so much for your time. Professor Rispel, let me begin with you. Taking a look at where we are, is extending the current lockdown level 4 restrictions an answer to still managing the caseload of COVID-19?
Good evening, Kathy, and good evening to your viewers. It's always difficult to predict what the president will say, but just looking at the numbers, over the last 24 hours, we have more than 20,000 COVID cases and another almost 300 deaths. And if we just look at the cumulative number of positive cases over the last week, we in Gauteng, for example, it looks like we will turn the curve in the next few days, perhaps in the next week. But in the other provinces, the numbers are actually going up, and so it's too early to certainly to discontinue some of the restrictions. There might be some amendments, but certainly in the case of the alcohol restrictions, the reality is that as a nation, we have a very conflicted and contested relationship with alcohol, Kathy. And so alcohol is both a risk factor for, and it's a cause of interpersonal violence, of motor vehicle accidents, which often bring serious injuries to our hospitals. And that, of course, means that there's even further pressure on the health system. And at the moment, hospitals, both in the public and private health sector, are really battling under the strain of COVID-19.
Professor Sanne, your own view in terms of what should happen next and as far as these restrictions are concerned?
Yeah, so good evening, everyone, and thank you for your interest. I have got fairly pessimistic views on this. I believe that Gauteng is still going to continue to have very high incidence of COVID for at least another, I would actually say 2 weeks, particularly hospitalization rates, as the hospitalization rates actually follow the infection rates with a delay of about 2 weeks. I also am very pessimistic for the very rapid rising rates in particularly Limpopo, Mpumalanga, and the northwest provinces. The country is overall in this third wave much more affected than it was in the second wave. And my understanding of what is occurring in both the public and private spaces in a well-resourced province of Gauteng is that every facility at this point has a triage facility outside the hospital, a tented facility, that basically does, as they cannot accommodate the patients. There are probably today no ICU beds and no high care beds available in Gauteng. And so, in fact, I would recommend to everyone to really avoid, doing something else and avoid having a car accident at this time because the hospitals cannot accommodate you. So I have, in the Minister's Advisory Committee, my personal opinion is that there has to be an extension of the lockdown for. The impact on the economy we understand, or I personally understand, the severity of that, but it is not conceivable to me to continue to have this very these high rates of COVID continue without us engaging. I do think that the population of Gauteng has now realized this, and I think that there's almost no family in Gauteng, there's no person who doesn't know someone who's become infected with COVID, who's sick with COVID, who's hospitalized, or may have unfortunately died. And so my perception on the roads of Gauteng is that people actually are much more careful, not going out, that mask wearing has improved enormously, And so overall, I think that the population is voting with their feet and taking the restrictions to heart.
Professor Sanne, given how overcapacity or undercapacitated the hospitals have been when it comes to responding to the need in this moment, when you just cast your eye over what's happening nationally, do you think that the other provinces have been adequately preparing for an increase in cases? Of course, we know what the situation in Gauteng has been, but do you have reason to believe it will be better or different for the likes of Limpopo in the Northwest and the Western Cape, as you've been talking about?
So I participate in the National Department of Health advisory group that works on hospital readiness. We are working with all of the provinces to scale up the surge capacity of hospitals across the country. We currently are focused on Limpopo and Mpumalanga because, the maximum capacity that those provinces have is far less than the maximum capacity that Gauteng has. And so there is a scramble to make those hospitals ready. We focus first on surging within existing facilities, so we up the number of beds available within existing facilities, and then there are moves to put down the triage capabilities to improve the diagnostic turnaround time within the primary healthcare CHC levels, and to up the oxygen capacity across the province. So my own organization is busy mapping which hospitals need to have additional liquid oxygen capacity. We are working with the main suppliers, Air Liquide and Afrox, to address the liquid oxygen capacity of those hospitals. We're now monitoring on a daily basis where cylinders of oxygen are situated within the supply chain, and indeed trying to do our best. However, the transmission, the other way of stopping this is to reduce transmission. So we call on the citizens to really follow the level 4 guidance. It is, not being enforced as severely as originally in wave 1, and we really are looking to the citizens of this country to self-impose that social distancing, mask wearing and hand washing that has been recommended throughout. That does work. We know it works. We know that we can turn around waves of this pandemic by people actually distancing and engaging with all of these interventions that they can make themselves.
Professor Rispel, we sound very much to still be in the eye of the storm. What does this mean for South Africans and what we should be anticipating and expecting over the coming couple of weeks? Because, of course, some industries are anxious to get back to work, and it's understandable because it's people's livelihoods here that are really being dealt a blow.
Kathy, we have to continue with those non-pharmaceutical measures that Ian has mentioned a short while ago. And I think we also have to step up the vaccination program. But one of the things I want to highlight is that there's little emphasis on the kind of strain and the pressure that on health professionals, on the health workforce. And so as a community of citizens, we also have to think, of course, we have to protect ourselves through these hand washing, sanitizing, not actually wearing masks, making sure that we stick to those regulations, particularly around funerals. Kathy, I think there's still perhaps there's still a belief that it won't happen to us. But I think there's inadequate enforcement of the regulations, particularly in relation to funerals. And so they continue to be, super spreader events. And I know it's a very difficult thing because generally the COVID pandemic has also changed the nature of grieving. But so we have to protect ourselves, but we also have to protect our health workers, because they are also exposed, they're also at risk. And so even if we have all the hospitals and all the beds in the world, if we don't have health workers to attend to sick individuals who need hospitalization, then we might as well not have those extra beds or hospitals. So I would really make an appeal that especially we comply with those with the non-pharmaceutical measures, especially in relation to funerals, because there are so many. Just if we look at the last 24 hours, there are close to 300 people who have passed away. Of course, at the end of every death, there's a grieving family. It means that there's a funeral. And so it's just around how do we actually make sure that funeral for a loved one doesn't become another super spreader event.
Professor Ian Sanne from the Right to Care and Professor Laetitia Rispel from the Wits University. And of course, that's a status update in terms of their own analysis of where we are. Unfortunately, that picture